we don't want to get into a cycle of painful sex, okay? So if someone is experiencing pain during sex, I always say stop. Remove whatever you're being penetrated with and start to play in different ways, because historically women are taught that sex starts when a male gets aroused and it ends when a male ejaculates. But there is so much in between times that it should be focused on, and it's not about the male being inside you. It's about pleasuring each other in different ways. So stop having penetrative sex, remove that from the table for whether it's a few days, a few weeks, whatever it is, until you feel comfortable, and play in other ways and enjoy each other's bodies in different ways, or enjoy your own body in another way. The next thing I would say is
Heather, I am so delighted and excited to finally have you sitting at the table with me. So to all our listeners, Heather and I have been friends and acquaintances for quite some time. We keep passing ships and talking at similar events, and this lady is incredible. So I'm so excited, and I feel like I've got about 3,000 questions for you. So buckle up.
Yeah.
Are you ready?
I'm ready. I feel like we just need a margie or something to go with this.
That's right. Okay, so can we just cut to the chase? We will eventually backtrack.
Okay.
But I want to talk a little bit about sex. Is that all right?
Of course. It's only one of my favorite topics.
I know, we know that. So I want to talk to you a little bit about sex in midlife and sex in the menopause, and there's lots of misconceptions and lots of fears, and there's lots of real symptoms that women suffer from. We get people having painful sex.
Yeah.
We get dry vaginas. We get libido dropping off a cliff.
Yeah.
We get women telling us they really struggle to have an orgasm and sex is very frustrating. Can you tell us what the hell's going on?
So sex is so multifaceted, as you know. So there are some mechanisms that are purely biological or mechanical when it comes to sex. But then you also have all these other things like emotions and stress levels and sleep habits that are really important when it comes to your sex life as well. So I guess my specialty is talking about sex from that mechanical side, and particularly the pelvic floor's role in sex life. So as we get older and as we go through different life stages, I guess maybe the first one we can chat about is the postpartum stage. So generally that's women in their 30s nowadays, sometimes early 40s. And what they find is that after they've had babies, their sex life or their libido is completely dissipated. And yes, that can be due to things like lack of sleep, thanks to a newborn or toddlers, and stress and all of those things. But especially if you've had a vaginal birth, it can be a pelvic floor dysfunctional issue. Now, the pelvic floor plays a role in supporting around the vaginal canal. Or imagine like a structure around your vagina. And if your pelvic floor is strong, it means that structure is strong, which means you can grip better during penetrative sex. Whereas if the structure is quite weak, or your pelvic floor is quite weak, then the structure around the vagina is also quite weak. So sensation may not be there, which means for women, penetrative sex can be just not fun anymore because they're not getting that beautiful sensation they used to be able to experience. And then there's all these other factors and fears that come with that of like, my body's changed so much. What is my partner thinking? Is he or she enjoying it as much as I am not enjoying it? And so you've got all these like multifaceted things going on in your head postpartum. So I like to explain to women that when it comes to pelvic floor, that is very easily treatable in very many cases. It's just about identifying and knowing that it's not normal and there are options out there for treatment. And then as we kind of get older into our peri stage, the hormones and the roller coaster of hormones that we're experiencing create muscle laxity. And the pelvic floor is not immune from the muscle laxity either. So a stat that we hear a lot is, and you would know this, that you lose about 10% of your muscle tone during peri. So your pelvic floor is just another muscle. So if you don't already have a good baseline strength of the pelvic floor, then during peri, it's just going to dissipate and get weaker and weaker, right? And then once again, that's going to play a huge role in your sex life. Now, another really common thing that I like to educate women on is the pelvic floor's role in female sexuality and the anatomy of the female orgasm, because it's so misunderstood. like a lot of things.
I'm leaning in.
Yeah, get ready for this. I mean, like women's health in general is so notoriously underfunded and under-researched. Like, I think the first model of the clitoris was only ever really researched in 2016. I think it was part researched or part authored by a researcher up in Brisbane, actually, at one of the universities there. But, for example, in that research, what they found, which is so intriguing, is the G-spot, right? They found that the traditional understanding of the G-spot, it was created by a guy, obviously, is actually completely false. And the reason why we get all those good sensations with G-spot palpation or touching of the G-spot is actually because we're touching a different part of the clitoris. We're hitting the clitoris from a different angle, and that's why it feels so good. So, as I said, female sexuality, super under-researched. It's all very fresh. But what we've found is that the pelvic floor plays an absolutely pivotal role in a woman's ability to climax. So, let's start with phase 1 of the sexual response stage. That is that phase where it's like foreplay. Things are feeling really good. You're starting to get into it. You're starting to get aroused. And during this stage, the pelvic floor's role is to contract, to switch on, and that helps keep the blood flow in the vulva. So keep it nice and juicy and swollen and lots of blood flow there and start to get it lubricated. And then as you progress in the sexual response phase, you go through what's called the plateau phase. And I want you to imagine getting intimate, things are feeling really good, and you kind of hit that plateau. It's very self-explanatory where things just feel really good for a really long time. You just want to keep it going. That's called the plateau stage. And during that stage, your pelvic floor's job is to act like a bit of a butterfly and just do like little flutters. And those flutters bring more sensation to the area and make things feel even better. And then, here's the kicker, when we get into climax, the pelvic floor's job is to go through a really steep relaxation and then a really sharp contraction. And it is the difference between those two things that get you over the hump to climax. So if you really struggle to relax the pelvic floor, or if you've got a really weak pelvic floor and you can't contract it, that climax is going to be really hard for you to get there. And then once you hit climax and you go through the orgasm, we talk about like waves of pleasure when you orgasm. It all stems from the pelvic floor. So the pelvic floor contracts and releases at 0.8 of a second during that stage. And it then sends a little message to all of the other muscles in your body. And those messages give you that whole or all over body orgasm or the all over body sensation. So I like to explain that to women because I think that there's this assumption that the pelvic floor, its only job is to stop you leaking. And it's so much more than that. Like another good example is, and we can do this together actually, Shauna. So flex your foot for me. Okay. Before you even moved your ankle, guess what body part switched on subconsciously?
Your pelvic floor.
It did. So that just gives you insight into how bloody important your pelvic floor is into almost every movement you make, into your sex life, and also into your daily lifestyle to make sure that you're protecting your organs and avoiding leakage.
So we're going to stop you there and we're going to do a little bit of a reverse.
Yeah.
And we're going to talk about, so what is the pelvic floor? Because lots of people don't even know what we're talking about.
Mm-hmm.
So can you explain what our pelvic floor is? I see you have a little model there. I know only our YouTube viewers will be able to watch, but anyone listening will try and explain as best we can so you can visualize. But
Yeah.
can you tell us what is the pelvic floor?
Isn't it wild that there's so much mystery about it? Like, did you learn any of this in high school?
Definitely not in high school.
No,
Definitely
me
not.
either, which is so crazy to me because, as I said, it's so important. So your pelvic floor sits between your two pelvic bones, okay? And it forms like a hammock, or if you imagine your bathroom basin, it's kind of this like scoopy bowl between each side of your hip bones. And its main job is to prop up or hold up 3 very important organs for a woman. So your bowel, your bladder, and your uterus. But not only is it propping up and holding up those organs and helping protect them, but it also has 3 holes in it. One for your urethra, which is where you wee from, one for your vagina, where we bleed from, and one for your bowel, which is obviously where you poo from. So that's when the structural framework of the pelvic floor comes into play, because it forms a structure around those holes. So it needs to be able to contract to help keep those holes tight when we need them tight, but also it needs to be able to relax to make sure that those holes can release and let things out when we need to let them out. So, for example, your pelvic floor, when you do a wee, it needs to be able to relax and release so you can fully empty your bladder properly. Same as when you do a poo. And if your pelvic floor is quite tight and grippy, it means you might have issues with constipation because it can't relax and let the poo out. And it's the same with the vagina. So if your pelvic floor is too tight and really struggles to relax, that's where we lead down the road of things like really painful sex, and a whole bunch of other issues. But then if the pelvic floor is too weak and too lax, then it struggles to grip during sex. So they're the main functions. I do want to mention as well that it connects at the back to your tailbone or around your coccyx. So it plays a really important role in things like posture. And then it connects at the front to the pubic bone. So it's quite a large stretch of muscle, and it has quite a number of different functions.
And it was really good there that you highlighted. I think a lot of people have heard of having like a weak pelvic floor, or people will say, oh, my pelvic floor is quite weak. But what a lot of people don't understand is that actually it can be too tight and too sort of hyper contracted. Can you talk to that, and what kind of symptoms would people experience if that was their problem?
Yeah, and that's such a good question because a lot of the symptoms also overlap with a weak pelvic floor. So women out there are like, but wait, what am I experiencing? So let's kind of run through them. The biggest symptoms of a tight pelvic floor that I find in clinic are painful penetration. But the problem with that is painful penetration can also come from things like prolapse, which is where some of the organs might bulge through the vagina. Another symptom of tight pelvic floor is also leakage, because although your pelvic floor is tight and the structure around your urethra is quite tight, it's also really tired or fatigued. It's a tired muscle. Um, a good analogy would be, imagine if you're running a marathon and you're so strong, but towards the end of the marathon, even your strongest muscles are eventually going to give way. It's kind of the same with the pelvic floor. If your pelvic floor muscles are switched on all the time, yeah, they might be tight and they might be strong, but they're also bloody exhausted. So the moment we get, it's called extra intra-abdominal pressure onto that very tired muscle, and that can come in the form of things like jumping or leaping, then sometimes the pelvic floor just lets go because it's so tired, and that's where you get the leakage. Constipation's a big one. And a couple of other ways that the pelvic floor impacts more is, I also find that our women who are quite stressed and operate at a really high cortisol level, they also tend to be in the more hypertonic mode, or the overly tight pelvic floor mode. Now, the reason being is that your pelvic floor and your diaphragm, which is your body's breathing muscle, they're like best friends. So when one comes up, the other goes up, and when one drops down, the other drops down. Now, your diaphragm is responsible for dropping down every time you take a deep breath in, okay? And if your pelvic floor can't drop down, then your diaphragm can't drop down. So it means women are constantly breathing into their neck and into their shoulders, which then is called shallow breathing. And that has all of these like domino effects on struggles to sleep, higher stress levels, higher cortisol levels. So the pelvic floor, like, it's so multifaceted and plays such a huge role in different parts. But they're probably the key symptoms. Actually, another one would be lots of tailbone pain or coccyx pain. And when we do a bit of a medical history with a woman who comes in, it's also really important to understand her background of trauma, whether it be physical trauma or pain or mental stressful trauma. Because another fascinating part of the pelvic floor is that we refer to it as your body's trauma response muscle. Now, we can practice this as well, and you can do this at home. So just picture what you do if someone's coming at you to tackle you, or, for example, if a car's coming towards you and you feel like you're about to get hit. Your body braces, right? It braces in response to the fear or the stress. And your pelvic floor is the first thing to brace. It switches on, and it's meant to do that because its job is to protect those very precious organs and keep you stable and strong in the core to help alleviate any of the physical stress that's about to hit you. But the problem with the pelvic floor is after that initial brace, it really struggles to relax. So if someone has experienced a lot of physical or mental trauma or stress in their life, sometimes their pelvic floor is quite tight and switched on as a protective mechanism for the body.
And so what can you do to help someone who has that? Because I definitely see a lot of patients who've had a lot of sexual trauma in their past, and they often have quite tight pelvic floors. They're very anxious about things like having a cervical screening test, like it's their worst nightmare, or if I need to send them off to have a pelvic ultrasound, they're completely terrified of the thought of that.
Yeah.
What do you guys do to try and help people who've got that kind of hypertonic pelvic floor?
Yeah, so in the clinic, we look at working on what's called a compensatory muscle pattern, which is where if one muscle's really tight, oftentimes other muscles around it begin to rely on that tight muscle, and they decide to shoot off to Fiji, have cocktails by the pool because they're like, oh, the pelvic floor is switching on for us, so we don't really need to do any work. So we try and bring those muscles back from Fiji to help support the pelvic floor around it by providing the muscle strength that should be there in the first place. And that gives the pelvic floor a fighting chance to relax. We then work through things like diaphragmatic breathing to help relax the pelvic floor, and also things like yesterday I did an Instagram post on perineal bulging, which is where you release and relax your perineum into, for example, a chair, or if you are sitting on a rolled up towel, you focus on really relaxing and letting go of that perineum towards that towel. And it's called biofeedback. It helps you get some feedback on the perineum to see and feel it relax. Things like that really help. Stretching. So poses like happy baby pose and child's pose, which are both yoga poses, are really good for helping release and stretch out. Anything that is going to stretch out your inner thighs is also going to help stretch out the pelvic floor because those muscles are interconnected. So that's the first thing. The next thing I would suggest to women who are suffering through painful penetration is we don't want to get into a cycle of painful sex. Okay. So if someone is experiencing pain during sex, I always say stop. Remove whatever you're being penetrated with and start to play in different ways, because let's reframe what we think about sex, because I think historically women are taught that sex starts when a male gets aroused and it ends when a male ejaculates. But there is so much in between times that it should be focused on. And it's not about the male being inside you. It's about pleasuring each other in different ways. So stop having penetrative sex, remove that from the table for whether it's a few days, a few weeks, whatever it is, until you feel comfortable, and play in other ways and enjoy each other's bodies in different ways, or enjoy your own body in another way. So remove the pressure of having to have penetrative sex. The next thing I would say is to start getting familiar with your own body. So I'm a huge advocate for women giving themselves internals once a month, because I like to treat the vulva and the vaginal canal as any other part of your body. That we have all this like stigma and shame around that body part because we're never really taught to understand it or look at it or touch it. And there's so much shame around touching your vulva, especially if you were brought up, in the 80s and 90s like we were. So I say to women, treat the vagina like any other part of your body, and you check your breasts for lumps and you look at your skin for changes in freckles or skin cancers. So why should your vulva and your vagina be any different? I suggest doing internals by yourself because generally you are more relaxed and there's less pressure associated and you don't have to think about anyone else. So I always say start in the shower once a month, slide a finger up the vaginal canal, and what you're feeling for is changes in the texture around the vaginal canal. And also feel for any bumps or bulges or lumps, which could be signs of prolapse, and track that, because prolapse is not scary. It's not crazy. It happens to 1 in 2 women who have had one pregnancy, let alone more than one pregnancy, right? So it's not anything to fear, but it's important to know what you're dealing with and then to note any changes. This can also help with women who have painful penetration, because once you become familiar with that part of your body and once you become used to feeling it yourself, then you're going to be potentially more open to have someone else feel it and touch it.
Can women who have had cesarean sections still have pelvic floor issues after having a pregnancy?
Yes, absolutely. The reason being is because if you imagine what your pelvic floor does as you grow a baby. So Bubby gets bigger and bigger and bigger, your belly gets bigger and bigger and bigger. So the pelvic floor has to get stronger and stronger and stronger to help counteract the extra weight of Bubby. An analogy would be, imagine if every day you're holding a weight in your bicep, and then every single day the weight goes up like 20 grams or 30 grams for 9 months. by the end of that 9 months, Shauna, that bicep is going to be bulging. Like Arnie Schwarzenegger is going to be jealous. But then one day, the weight is just suddenly removed from that bicep. And so the bicep's really, really strong and it's never been released or relaxed. So it's kind of held in this overly tight, overly strong position. Now, that is really similar to what happens when you have a C-section. So your pelvic floor gets stronger and stronger and stronger to do its job of helping support Bubby as it grows. But then the next day, Bubby's removed through the sunroof, but there's been no relaxation or release of tension in the pelvic floor. So we find that a lot of women who have C-sections end up in that hypertonic state or overly tight state because it hasn't, like with a vaginal birth, the pelvic floor is forced to release and relax with the birthing process. So they haven't been put through that process. So for them, it's really important to work on lengthening and relaxing motions with the child's pose, and cat and cow is another really good movement, or happy baby. But also make sure that they work on their tummy strength post giving birth, because the tummy muscles have been obviously surgically operated on. And so to rebuild that strength can be really tricky.
Heather, your enthusiasm is just comes out of you, which is just amazing. Tell me how you've ended up in this sphere. What prompted or excited you to work in this field?
Yeah, so it has been a very wild ride. I started my career out as a journalist, and I studied journalism at university and went on to become a writer and freelanced for a range of different publications. And towards the end of my journo career, I was the editor of a number of different magazines, the last being a health magazine. And that was where my passion for health really began. And also my passion for reading through journal articles and taking what is often complex medical jargon and turning it into something that's really easily digestible for the average person, and also fun for the average person to understand, because a lot of the journal articles, as you know, are very dry. So that was my entire job while I was the editor of the health magazine. And it's during that time I started my degree in health science because I just wanted to learn. I wanted to be a sponge. And then I had 2 babies and I went on mat leave. And after my second bubby, I took my toddler to a trampoline park. And I would have been about 3 or 4 months postpartum. And I started jumping on the trampoline. And I'm sure a lot of women out there can resonate with this. I was like, oh God, what is happening here? I was wearing black tights, thank the heavens. So I quickly got off the trampoline because I knew I was about to wet my pants. And I initially was so angry. I was so angry with my own body because I felt like it had failed me, which is crazy now looking back because it had just birthed a kid. But I was also really angry with the health practitioners I had touch points with in the past. A, for not telling me that this could be an issue, and B, for not helping me prevent it. And then I was also really angry with the entire education system because, as we talked about, like at no point was female sexuality or pelvic floor care included in our high school anatomy classes. And it's so important. So I needed to find a treatment to help me. I was really time poor because I had 2 kids and I was trying to work pretty much full time, and I was also studying full time. So I needed something really quick and effective. And I found what was called an Emsella chair. I had to drive 2.5 hours to get to that Emsella chair initially. And it wasn't a family friendly clinic, so I had to tee up babysitters. So it was a whole shebang for me to try and get this treatment. But after one session, I had such an incredible improvement in my symptoms that I was like, we need to make this more available to more women. And so because I couldn't find a clinic that suited me and my needs, I created one. And that's where Core Restore Co came into play. And then since I started Core Restore Co, I finished my master's in women's medicine. I did a diploma in Pilates so that I could have a really good understanding of the muscles and the response to all of these symptoms as well. And I'm just finishing now my master's in sexology. So that is how I got to where we are now, which is 4 Core Restore Co clinics across New South Wales. And yeah, we've treated thousands of women over the last couple of years. And it's wonderful to see improvements and see the incredible life change that women can experience after just a couple of weeks of treatment.
And do you treat any older women?
Oh God, yeah. So I I have this absolutely beautiful woman who's very happy with me to share her story. She was 89 and she used to travel up from Wollongong to our Sutherland Shire clinic twice a week for the 3 weeks with her gorgeous husband. Her name was Snez. And she'd come on into the clinic and she had been living with wearing pads for the last 5 decades of her life. And within her 3.5 to 4 weeks of treatments with us, she was not wearing pads anymore. So seeing the life change that can happen at any stage, I mean, 89. I love that story because I'm like, it just shows that the older we get, we do not have to sacrifice. And as women, we sacrifice so much. This is one part of our life that we do not have to give up or sacrifice, and that is the mental load that comes from having to wear panty liners every day. You do not have to deal with that. You shouldn't have to deal with sexual dysfunction. Sex for a female should be exciting and fun, and there should be passion, and you should look forward to it. They shouldn't be, because sex is such a joyous part of life, right? So you shouldn't have to sacrifice that. And you shouldn't have to sacrifice on things like your core stability or your strength and your ability to work out safely. All of those things are so important to live a fulfilled life that you shouldn't have to give that up.
On Sunday morning, when I was out walking at Terrigal Beach, which is a local beach, I kept crossing paths with a number of women who all had vests on, just like me, weighted vests. And we all gave each other a bit of a knowing look because these have become very, very popular in peri and post-menopausal women. You might not know what rucking is, but basically what it is walking with either a weighted vest or a weighted rucksack. I personally opt for the weighted vest because I find it very, very comfortable and very, very quick to put on. So for peri and postmenopausal women, there are definitely a number of health benefits that you can gain from walking with extra weight. One of the health concerns that many women have at this stage of life is developing heart disease. And unfortunately, we know in the postmenopause, the rates of heart disease for women really start to accelerate. So why might rucking or walking with weight change that? Well, basically, whenever you're walking with additional weight, it increases your heart rate more, and it basically makes your heart exercise a little bit harder. So hopefully making your heart a lot more healthy. So that's one of the benefits of rucking in comparison to standard walking. So if you're intrigued and ready to start rucking, my recommendation would be that you start low and go slow. So start by choosing a weight that is 5 to 10% of your body weight at maximum, and take it slowly. Go for maybe a 10 to 20 minute walk at first. Don't decide to go on a 5-hour hike the first time you strap on your weighted vest. So we've been chatting to our friends at Rucksack, and I've got a special discount code for you. So if you go to their website, which is www.rucksack.com, so RUKSAK.com, and use the code Shauna15, so that's SHAUNA 15, you're going to get a 15% discount. So whether you decide to go for a vest or whether you decide to go for one of their backpacks, either way, you're going to get 15% off. Now, let's get back into the episode. So many women think in lots of facets, I think I've left it too late. And I think the reality is there's very few things that actually you really have left it too late. Okay, sometimes it's great, and of course prevention is better than cure, but don't assume that you can't be helped with so many things, because you actually can.
And this is why having a health professional that's on your side, like you, is so important, because you will advocate for women. And I know that there's so many women out there who struggle and feel like they're being sent from person to person because no one's listening. So it's so important to have someone that listens to you and that will understand what your needs are and provide treatment options for each of those needs.
Yeah, absolutely. So is there anything that people might be doing in their day-to-day life that's actually unwittingly negatively impacting their pelvic floor? Like, are there any habits that you like go, no, stop doing it?
Oh, there are a few. And oh my God, you guys are going to hate me for these. And I'm so sorry. First of all, heels. These little guys are pelvic floor killers.
Okay.
Yeah. So, did you know there was research done that looked into foot placement and how it affects the pelvic floor? And what this research found was when you're in like that pointed toe or wearing a high heel, foot placement, your pelvic floor is like totally switched off. It's not good. If you are flat-footed or neutral-footed, so walking barefoot, your pelvic floor is at a really beautiful baseline. It's how it's meant to be, which is, I mean, surprise, surprise, how we're meant to be. And then if your foot is flexed, your pelvic floor is forced to switch on slightly. So we know that wearing heels for a long period of time it's not good for your pelvic floor. And you may even find that your symptoms of like feeling heavy or you feel leakage or maybe even prolapse are worse after wearing wearing heels for a day. So that is one thing.
Per Victoria Beckham.
I know, she needs to come into a core clinic. Start. Vicky, if you're listening, I'm your girl. Another thing that you guys are going to hate me for is squatting over a toilet seat. So I know public toilets are gross and the last thing you want to do is sit your butt down, but I promise for your pelvic floor, you need to do it because when you are squatting, your pelvic floor's job is to switch on and hold everything tight. And remember what we learnt before, that if your pelvic floor is tight, it can't release around your urethra. So you're not going to be able to fully empty your bladder. So my hot tip for that would be if you are a little bit of a clean freak, which I completely resonate with, maybe have some sanitizing wipes and wipe down the public toilet before you use it. Put toilet paper down, but please, please, please sit that booty down when you do a wee. Toilet stools.
I was just going to say, what a poo stool.
I love a poo stool. I'm shocked that not everyone has one in their house. Every hotel room should have one. Guys, it's so important.
We're just recycling our toddler stools.
Yeah. Oh my God, same. Mine was like $12 from Kmart or something. So they're not expensive. Please get one. The reason being because when you have your knees when your knees aren't propped up, there's this little almost like a sling that attaches around your bowel, and its job is to kink the bowel to stop you leaking. But until your knees are propped up above your hips, that sling stays tight. So it's it's harder to empty your bowel. You're going to have to be straining more. So we want to release that sling with your knees nice and high with the toilet stool to help things like come out a lot easier, because any sort of pressure or pushing or straining on the pelvic floor is also a no-no.
Maybe they need to invent a toilet that's on a bit of a slope.
How has no one done that already? Shauna, you and I, this could be a new job. This could be a new business idea. Toilets by Heather and Shauna. Who wouldn't want to sit on us?
I know, exactly. Oh my God. Oh dear. Okay, and so that's the things that are negative. What can you do positively to help your pelvic floor? Apart from wearing flat shoes, poo stool.
Flat shoes, pool stool, hydration, keeping things hydrated is really important, not just for your pelvic floor, but for all of your muscles and your entire body. We want to make sure that we're emptying our bladder each time. But also actually back to the hydration side of things. If you are dehydrated, your wee is more yellow, right? It's more concentrated. And that means it's more of a breeding ground for bacteria. So UTIs are a total pelvic floor killer. We want to avoid those wherever possible because they place extra pressure on the pelvic floor. So making sure you're hydrated to avoid UTIs as well is very important. Also things like doing pelvic floor exercises is a great, and it doesn't just have to be Kegels.
So I'm going to stop you because what I do think is that what has happened over the years, I don't know what other people's experience, but I had 4 children, and to be honest, I appreciate everyone was busy, but the midwife would just kind of give you a little tap in the leg and say, don't forget to do your pelvic floor exercises, as if in somehow everyone magically knows how to do a pelvic floor exercise. So whenever we're talking about pelvic floor exercises, what on earth are we talking about, and what do you want us to do?
Okay, well, we can do this together. I will preempt it by saying research actually shows that 40% of women who are told to do a pelvic floor exercise are actually doing it wrong and causing damage. So this is why it's so important to have body awareness, to make sure you see someone, whether it's someone at Core Restore Co or you're a gynecologist or a pelvic floor physio, to make sure that when you are contracting, you're doing it right first. But a good way to do it is, and probably my favorite way, so we won't do it together because it involves us putting a finger up our vagina.
Okay, and
we're not quite that close, right?
On per entry, we'll love to count.
But here, I can use my anatomical vulva to explain. A good way to tell whether you're doing a pelvic floor contraction is by using your finger and sliding it up the vagina, because remember, your pelvic floor wraps around your vagina. So what you want to do is inhale and really relax around that finger. So you want to feel like no grip around that finger. And then as you exhale through your mouth, we want to contract around that finger and feel the grip around the finger. I'll show you, demonstrate for my YouTube video, people. You want to feel it grip, but then you also want to feel it almost like lift inside you. Okay. Those two separate movements of the grip and the lift are really important when it comes to a pelvic floor contraction. And then as you inhale again, you release. And that finger should be able to almost slide out with that release. You really want to have a huge difference between the relax and the contract. So that is what we're looking for when it comes to a really good pelvic floor movement. A really good grip and a lift, and a really good relax. Both of those super important. So that's a good way to measure your strength at home, because I know a lot of women may struggle to get into a practitioner, or maybe the drive's too much, or whatever it is. So this is where I really am passionate about women taking control of their own health and having a really good baseline understanding of their own body. So try that at home. Another way, if you don't feel comfortable sliding a finger up, is to even just have a look at the vulva, because what you can see is when your pelvic floor contracts, you should be able to see around the labia, it kind of contract inwards and lift up as well. So you can use a mirror to look at what's going on. But you don't just have to sit there and do pelvic floor contractions to get your pelvic floor working. There are exercises that just work your pelvic floor by default. And that's also what I try and encourage women to understand, because not everyone has, a spare 3 minutes every day to focus on just sitting there and doing Kegels. You're trying to cook dinner, you're trying to bath kids, you're trying to work, you're trying to make phone calls. Like, there's so much else that you're trying to do. I don't want to add to that mental load anymore. So look at what you're already doing workout wise. For example, things like a wide-legged squat is a really good. Research has actually found that it's better for the pelvic floor workout than a standard Kegel is, or a standard pelvic floor contraction. So wide-legged squats are really good. Lunges are another really good option to work the pelvic floor, and also work your core, because it focuses on stability. And things like clams are a great one. Glute bridges are a good one, especially if you add a little inner thigh squeeze at the top of the glute bridge. So there's so much more than just sitting down and trying to squeeze. That's what I'm trying to say. There's lots of options out there. In clinic, we used, as I mentioned before, the Mcella, which is like a no-brainer, because you literally just get to sit down. The technology does all the work for you. It takes you through almost 12,000 contractions. So over 6 sessions, it's about 6 years worth of daily Kegels in less than 3 weeks.
Wow.
Total no-brainer for women, right? Quick, easy, 30-minute sessions. And it's also a really good way to get that initial baseline strength and body awareness for the pelvic floor, so you can have long-term results when you leave us. So yeah.
Cool. And what about you're obviously trained in Pilates. A lot of our listeners are in Australia, some are overseas, but Pilates is massive in Australia. Everywhere I look, there's more Pilates studios. Like,
Yeah.
why is it so amazing? And why are women loving this form of exercise so much?
That's a really good question. I feel like I'm part of the Pilates cult because I love it so much. I think it's really great for women, firstly, because it's not just about constant HIIT workouts, which is not necessarily great for overall strength for a woman, particularly if she gets into the perimenopausal stage. And I actually just wrote an article for Women's Health magazine about why it's important to have all these beautiful lengthening exercises in your regime. First of all, it's good to make sure that we're not spiking up our cortisol levels all the time. But also, it's really good for maintaining flexibility in your body, which, as you know, is so important for injury prevention, especially as we get older. Pilates is also beautiful because it uses strength and you have the ability to add more weight to your movement, but it's not pushing you with really heavy weights like something like CrossFit or a HIIT workout may do, which then increases your risk of injury too. I think that's why it's such a beautiful all-rounder, and that's why so many women embrace it as well. It's just a beautiful, relaxing, but energizing practice.
And what's the difference between Pilates and reformer Pilates? Do you know?
Yeah, so I guess you can do mat Pilates, which is without a reformer, and you can do that just with a mat, really. You don't even need any props or anything like that, or even weights. So that's a good option, especially if you are trying to do something at home and you've got half an hour and you just need to find a YouTube video to help you out. It's a really great option. Reformer is with a reformer bed, which is a piece of technology that you can use, and it has springs that you can adjust to increase the load and tension to help you through exercises, and also to help make exercises slightly harder.
Okay. Okay, cool. Do you know if there is any benefit of HRT on your pelvic floor?
Well, yeah. So I guess the benefits are really similar to the benefits of the overall muscles. So we know that HRT can help avoid muscle wastage. And when it comes to the pelvic floor, my biggest concern is women head into the peri stage is that 10% muscle drop, right? Along with HRT, I also am quite passionate about topical estrogen to help with vaginal plumpness and dryness, because both of those things can play havoc on the pelvic floor as we head into peri as well. So if you've got thinning of the vaginal wall, as well as dryness, it can increase your risk of infection, which then plays a really poor role in pelvic floor health. So if we can almost double up, and this is a really beautiful protocol for a lot of women, obviously you need to get personalized advice, but a really beautiful protocol can be using something like a topical estrogen cream in the vaginal canal and then supporting around the vaginal canal or that framework with pelvic floor strengthening. That's a really nice way to get a holistic approach to vulvar health.
Okay, cool. And if I know we have a group of women who listen who are a lot younger, in their 20s and early 30s, and maybe are not even at the stage where they've had a baby. What would you advise them to be doing? I mean, it's kind of too late for me, but but it's
Sure,
not
it's
too late.
never
It's
too
not too late.
late.
But what can these women do to really set themselves up for future great pelvic floor health? Is there
Yeah.
anything you can do?
God, yeah, heaps that you can do. First of all, I would say start with that doing an internal every month. Get used to what your vulva and vagina feel like and note any changes that happen. And while you're doing that internal, let's like multitask because we're women. So do a little pelvic floor contraction around the finger and then a pelvic floor relaxation and note the difference between those two things. And once again, if something changes next month, you can put a mental note in to be like, I'm going to call Heather at Core, or I'm going to call my gyno. I'm just going to ask for some advice, or I'm going to talk to my GP, whatever it is. So get really familiar with it. Body awareness is one of my favorite things to preach, because that way you can be empowered when it comes to changes in your own body. The next thing I would say is start thinking about pelvic floor exercise and making it as part of your every week exercise regime. So a lot of girls do Pilates, which is so wonderful. If you are doing group classes and you're finding that there's no personalized cues, just make sure that you don't hold up your pelvic floor or contract it for an entire session. I think a lot of instructors make the mistake of cueing to switch on the pelvic floor, but they don't ever cue to release the pelvic floor. And like any muscle, your pelvic floor shouldn't be switched on for an entire 45 to 1 hour class. So just make sure that you're exhaling and contracting your pelvic floor, but then as you're inhaling, you're also releasing it and giving it a little break. It's not meant to be switched on nonstop for an hour. In terms of sexual wellness habits, obviously practice safe sex. As I said before, any sort of pain with sex is not normal. So stop and look at doing things in different ways. You should never grit your teeth and think of England through pain. That's not okay. And when it comes to bathroom habits, things like making sure that you're emptying your bladder all the time, making sure that you are listening to your body, and when you need to do a wee, you do a wee. Normally within, 10 to 15 minutes of that initial cue should be when you're releasing your bladder. So don't try and hold on. And nurses and teachers are notorious for this, for holding their bladder for hours and hours and hours. That's also not healthy. And so many of them come to me and they're like, oh, my pelvic floor is so strong, I can hold it for like 4 hours. And I'm like, babe, that's not normal. You should not be doing that. That's not good for your pelvic floor. Like, you're going to cause more dysfunction further down the track.
Should people be having a wee after sex?
I think yes. I know that there's a lot of research for both sides of the coin. Some of the latest research says that it doesn't make any difference, but I think releasing your bladder after sex is important, not only to like cleanse around the vulva from any other juices because our vulva remains at about a 3.8 to 4.5 pH level. You want to keep it that way, okay? But the other reason is how deeply into squirting should we go, Shauna?
You can go wherever you want to go.
Okay, all right. So this is what researchers found when it comes to squirting. They did a research project on women who could squirt, and what they got them to do was before sex, they emptied their bladder. So bladder totally empty. They went in, they pleasured themselves, they squirted, and during that entire time, they did ultrasounds on the bladder to check what was happening. What they found was that during the kind of plateau and foreplay stage, their bladder filled up with like this clear liquid really, really quickly, and then the squirting expelled that liquid really quickly. So what they found was and it was through the urethra, which is where you wee from, which is also why there's so much confusion around whether squirting is wee. Now, what that research kind of tells us is that although it's a substance that it contains similar things or similar properties to urine, it also contains prostate fluid, okay? But what that research tells us is that oftentimes during sex or during pleasure, our bladder will fill up quite quickly with this clear liquid. So if you don't squirt, it's still important to release that liquid.
Okay, sorry, I'm a bit lost here. It contains prostate fluid.
Yes. Wow.
Women don't have a prostate.
Well, it contains the same sort of stuff that's in
Oh,
prostate
right,
fluid,
okay,
which
okay.
tells us that it's different from urine because
Okay.
those two things do not intertwine,
Ah,
right? So it's like a sexual fluid.
Okay.
Yeah.
Right. So I was like going, have I missed a bit of female anatomy?
No. So back to the tangent, which was saying that during sex, our bladder fills up because women can squirt. So before sex, even if you've emptied your bladder, it's very likely that maybe your bladder's going to fill up. So you probably need to release that after sex anyway.
Okay. Thank you. Alrighty. I want to talk now finally about a subject that women find really, really difficult to talk about. And I know it takes women the average of years and years and years admit to that. And you actually told a story about a patient. But incontinence, both of urine and fecal incontinence,
Yeah.
is so much more common. So for anyone listening, if you have this problem, you're actually in a very silent but large group of women
2 and 3,
who
right?
are absolutely struggling with this. So I'd love to talk a little bit about incontinence and just to really reassure people listening that they are not the only person in the country with this awful problem and that
Yeah.
also they don't have to put up with it. So can we talk a little bit about the different types of urinary incontinence and a little bit about fecal incontinence
Yeah.
and what we might be able to do about that? Because there are people who are literally hiding and feeling so full of shame and embarrassed. I even know women who've given up their jobs, who've left relationships because they're so embarrassed by this problem.
Yeah, that absolutely breaks my heart. So research shows 2 and 3 women will experience this at some stage. So it's absolutely like very, very common. I think there's still so much stigma around it because we're not talking about it. So this is why it's so important to talk about it, but also so important to know that you don't have to live with it. Like there are treatments available. Let's go back to the question of the different types. So let's start with urinary incontinence. The main and the most common type that we deal with is stress urinary incontinence. That happens when you get extra, it's called intra-abdominal pressure, pushing down onto the pelvic floor, and the pelvic floor is not strong enough to counteract that pressure. So it's almost like you can't control and you start to leak. That can happen when you're jumping or sneezing or coughing or dancing or whatever it is you're doing. It's normal. Laughing. Yeah, big movements. And a lot of women find that they struggle with this. Actually, particularly during COVID, there was a huge spike in this because of all the sneezing and coughing and chronic coughing that people were doing. So yes, that is the first type. The next is urgency incontinence. And a good way to explain this would be when you need to wee, you gotta wee and you gotta go really quickly. And sometimes you might leak on the way to the bathroom. So remember how before I said normally you should release your bladder within, 10 to 15 minutes of that first initial stage. Women that have urgency incontinence, they tend to get a signal to their brain that's like, I need to wee. And they've got like 10 seconds max before they start leaking. It can also be habit-driven urgency incontinence. So I don't know if you've ever experienced this, but like you've gone shopping at Westfield, you leave the shops, you're fine, you don't need to wee. And the moment you get out of your car at home, you've got your house key in your hand, your body's like, whew, we got to go and we got to go now. And it's like you're trying to waddle or jump or run to the bathroom. And you're like, it came out of nowhere. That can also be habit driven or trigger driven. So for some, it's like looking at their front door. For others, it might be walking past a toilet or looking at a toilet. And they're like, 5 seconds ago, I did not need to wee. Now suddenly I got to go really quickly. And you can also have a mixture of both. So combined incontinence, which is stress and urgency smushed together into one nice little package.
What a gift.
What a gift. And then the other type is, as you mentioned, fecal incontinence. And it's a really similar mechanism to urinary incontinence because your pelvic floor wraps around your bowel like a framework too. So it kind of does the same thing. If it can't grip tight and turn it off like a tap, then you're going to have issues with leaking poo. But on the other end of the spectrum is if it's too tight, then you're going to have issues with constipation. So your poo can tell us a lot about what's going on with your pelvic floor. Both of these are really, really common, but absolutely not normal. And actually, one thing that I try and debunk in clinic fairly often is women who will call me and be like, oh, I don't know if I'm the right patient because like I definitely don't have incontinence. I only just occasionally leak if I'm sneezing. And I'm like, who is telling these women that any leakage is okay or normal? Like that's not okay. Like you do not have to live with that. So breaking down that barrier of like incontinence, yeah, maybe it sounds like a scary word, but it literally means any sort of leakage. You should not be leaking.
Yeah. Okay, perfect. Okay. Is there anything that you have a burning desire to tell us about or that we have not talked about yet?
I feel like we've covered a lot. I don't think so. I do think it's important to note as well another kind of quick little myth when it comes to your core. And that is that women tend to think their core is just their tummy muscles, whereas in fact your core is like this big wine barrel shape that includes the pelvic floor and the diaphragm and your tummy muscles and the spinal extensors on your spine. So when we say work on your core or create awareness with your core, it's not just about a six pack. There are so many deeper layers of muscle there that you need to work on activating, but also it's about your diaphragm and pelvic floor, which play a really key role as well.
Would you recommend if someone has had, a baby recently that they leave it a certain amount of time before they begin to start doing that core work?
Depends on what we mean by core work. I think the day after and even 48 hours after having a baby, you can still bring body awareness to those parts of your body. And I would say to consider it like any sort of surgery, where after surgery, you still want to be sending messages to a body part. Does not mean you have to contract it. It does not mean you have to release it, but just making sure that you're aware of it. Maybe try breathing into your pelvic floor, or if you had a C-section, just try breathing in. Imagine you're breathing into your tummy where the scar is, because you want to continue the neural pathways to that area. You don't want to leave them dormant for too long. And then when it comes to like core exercise, if we're talking things like planking and that kind of thing, I would definitely wait. And it depends on what sort of birth you've had. I would definitely wait and get personalized advice for that. But things like in the initial stages, so from about 6 weeks onwards, most women can start doing things like cat-cow stretches, where you are on all fours and you flex and extend the spine. And then even things like opposite arm, opposite leg reaches in that 4-point kneeling position, they're really good ways that don't put too much pressure on your muscles, but just increase the awareness and start getting them working again. So take it really slow and don't jump into any sort of intense workouts unless you have a health professional by your side guiding you.
One of the things in the menopause space that we're encouraging our patients to do is to take up strength training. And often this is women who maybe have never lifted any kind of a weight in their life. And I do know that some women have really very clearly told me they're really scared to do that because they're worried about their pelvic floor and they're literally worried that they might lift up a weight and then wet themselves in the middle of the gym.
Yeah.
Have you any advice for women who are worried about that?
Yeah, learn how to activate your pelvic floor and learn how to breathe correctly before you lift. So we've talked a little bit about the diaphragm and pelvic floor connection, but this kind of tying back to that is so important when it comes to lifting a baby or lifting a heavy weight, whatever you're doing. So we want to be able to contract the pelvic floor up as we're lifting that weight to protect the organs. And also remember, when we're contracting that muscle, we're zipping tight around those holes. So the holes are gripped, which will reduce your risk of leakage. So correct lifting technique is, for example, if you're doing a deadlift, which is where you bend down and pick up a weight, what I want you to do is inhale as you bend down and grab that weight, and then exhale through your mouth as you lift or do the heavy part or the hard part of the movement. So when you're doing a deadlift, you exhale as you lift up. What that exhale does is every inhale, your pelvic floor and diaphragm drop down. Remember to make way for the lungs getting big. Every exhale, they're naturally meant to come back upwards, and the pelvic floor contracts, the diaphragm comes up. So by the pelvic floor contracting, we're protecting the organs. We're zipping tight around the 3 holes there. So we always exhale and contract the pelvic floor on the hard part of the movement. That will alleviate your risk of leakage. But I would say make sure if you are starting fresh, you've never done any sort of heavy weights before, get a PT or someone who's really well trained and well versed in women's health to guide you through it. Because the last thing we want to do is to have someone lift a 50-kilo weight and then cause all of this damage and potentially create issues with prolapse.
Yeah, I love my patients going to even have a few sessions with an exercise physiologist. I think it's just amazing.
It should be essential, I think, when you're getting into something that you haven't done before, especially if you've got any sort of perimenopausal symptoms or even postpartum, like get some personalized advice.
Yeah, I also love my patients postpartum to go and see a pelvic floor physio because I just think just go and do it.
It should be
like
I
really
mean, I could
mandatory.
rant about this for ages, but it should be part of Medicare and like all included as part of your normal postpartum journey.
Yeah.
Not only for your lifestyle now, but also to prevent the need for things like pelvic mesh surgery down the track, which is obviously far more costly and far more invasive, and recovery time is far longer.
Yeah, absolutely. I'm getting my patients now to, I've got quite into my weighted vest.
Oh,
My ruck
nice.
vest. So I'm getting people, getting people to do that.
Yeah,
I'll have to let you
amazing.
try. I'll let you try my
Can
one
you
on it.
please?
Yeah,
That would be fun.
I've got it.
Okay, done.
Okay, very last question, I promise. If you could talk to 20-something Heather, obviously assuming that you're more than 20. I know that you only turned into your 30s in the last few days, but what would you say to her?
That is such a good question. Okay, I would say, Hev, your body is fascinating and complex and intricate and wonderful. So do not expect or do not accept mediocrity when it comes to getting advice for your body. Your body is so amazing that you should be able to feel like you can question health professionals. And if something doesn't feel right to you, don't be afraid to ask and don't be afraid to get another opinion, because I think oftentimes we know our body so much better than what other people could know in a 30-minute session. And so if you don't think something feels right, please, please, please ask questions and make sure that you get a response, because your health professional should be there as a partner for you, not as someone that just tells you what to do.
Amazing. Thank you so much.
My pleasure. This has been really fun.
So if anyone wants to find you, where can they find you?
So we're on Instagram. We have a lot of educational content on there. So it's at core.restore.co. Our website's coreRestore.co. You can email, you can call, you can DM. I'm normally on the clinic number, so you will generally get me directly, and I'm always there and available, whether or not you come in for treatment, just to give you some advice or even to find someone locally that can help you out.
Heather, thank you so much.
Pleasure. Thanks, Shauna.
This podcast and any information, advice, opinions, or statements within it do not constitute medical, healthcare, or other professional advice. Information is provided for educational and entertainment purposes only. If you have any health concerns, always consult your doctor.